Hello, I'm Dr. Greg Winteregg, CEO of the Private Dentist Alliance. I want to talk to all of you students out there today who are wondering what your future is going to be like as a career in dentistry. As an assistant, as a hygienist, as a dentist, where is this profession going with the rapid increase of the DSO movement? I'm here to tell you that PDA is going to help you, and I want you to become a member today. It is free. Now, why should you become a member? You're going to get weekly video updates from me, and you're going to get regular updates of our newsletters from the Alliance on exactly what is happening and how we are going to help preserve and protect the private practice of dentistry. Now, to me, the most important advantage is you are going to get access to our job board. What is that? Our private practicing members all have access to our PDA job board, which means if they have an opening in their private practice of assistant, hygienist, doctor, front office staff, they're going to be able to post it. And you're going to be able to check up regularly. And as our membership grows, we're going to be covering larger and larger territories across the United States. If you are looking for a job in any position in the office of a private practice, you need to become a student member today. It is free. Go to www.privatedental.org and become a student member today. You're going to love your benefits. Do it now.
What is up, guys? It's your boy Matt Havis back at it with the Dental Supervisors Podcast. Today we have a really cool interview for you. We have Dr. Trent Neisen. He is a private practicing dentist in Minnesota. He just recently bought his practice 2 months ago. So he has a lot of good tips on, the whole application process to dental school, how you get in, the tips and tricks he used to propel him into dental school from a pre-dent. And he just talks about all things life as a dental student because he just recently lived it, and he tries to make it as easy as possible for us. Afterwards, he did do an AEGD when he graduated from dental school, and he talks about the application process for that and what you can expect and what you could look to get out of your particular AEGD program or GPR, depending on whatever you applied for. So we hope you guys really enjoyed this interview. We thought it was really cool. And as always, follow us on Instagram at dental.student.vibes. Give us a like, comment, review. Let us know what you guys think. And in these trying times, stay safe and vibe on.
Welcome back to another episode of the Dental Student Vibes Podcast. I am here today with Matthew Havis and the amazing Dr. Trent Neisen. Dr. Neisen, how are you doing today?
I am doing very well. Thank you for that awesome intro.
Right. So Dr. Neisen reached out to us and he wanted to share his story. He's got some great tips and tricks for all the students that are currently in dental school. Very excited to hear what he has to say and hear about his story. But another thing that we're very interested in is that Dr. Neisen has recently purchased a practice. And that's, the direction that we're going. We're looking forward to it. And we'd love to hear what you've got to say, Dr. Neisen. So Dr. Neisen, how's your week been? It's almost Thanksgiving. How's the week been going for you?
No, it's been a busy week. As you guys are saying, it's Thanksgiving week, and as we're recording this, I'm in Minnesota, and currently right now we are battling a lot of COVID, a lot of cancels. So it's a lot of stuff to balance with that. I don't know how things are in Florida where you guys are, but yeah, it's definitely been a challenge that's presented, especially in my community specifically right now. But we're doing the best we can. We're taking the best precautions that we can do. We had a busy morning this morning, and then kind of taking a little extra time off to prepare for, mostly an at-home holiday this year, but just to kind of spend a little extra downtime and come back recharged after the holiday.
Definitely. So I know a lot of people have been saying that they've seen the best production numbers they've ever seen. I guess, could it be from emergencies? Who knows, but have you seen any sort of that, anything like that in your practice? I know you just said that it's kind of taken a downturn.
I would say it's just we just encountered a lot of challenges, a lot of last second, day before calls, like, hey, I was in contact with someone who was in contact with someone, or hey, I got a fever, or hey. So it's honestly it's been some challenges. We kind of show up in the morning and kind of have a great schedule on the books, but sometimes things kind of fall apart. As far as record breaking stuff, I can't say I'm at that point, but no, we've been doing pretty well. Yeah, we started, I closed on the practice, and we'll kind of go through a lot of this, but I closed on the practice October 2nd. So we are just finishing up, will this be like, I don't know, maybe our 8th week of ownership. And yeah, it's been a journey. It's been some ups, been some downs, but through and all in all, through and through, I think first 2 months have gone pretty well.
Awesome. Well, I want to congratulate you. That's a huge accomplishment. Working all those years, undergrad, through dental school, to then finally be your own boss and have the practice and everything. That's really cool. So,
all right. So Dr. Neisen, let's bring it way back to when you were a pre-dental student. And can you give our listeners some tips and tell us about your journey into dental school, and then take us through each year of dental school? What was that like for you?
Totally. I can remember, so I went to undergrad. I'm from Minnesota. I went to undergrad in Fargo, North Dakota at North Dakota State. And I can literally remember like the day, it was like my second year, like right before Christmas break. I remember sitting in the union and like reading through the prerequisites. And I said, you know what, I'm going to go for this dental thing. I was intimidated by it. I think everyone kind of is, when you first think of pursuing dentistry, you hear, oh, it's so hard to get into, or it's really competitive, or, you got to have perfect grades and all that. And I still vividly remember the day looking at the prerequisites. It had been on my mind for some time, and I said, you know what, I'm gonna go for this thing. And I remember that. I remember making that decision vividly that day. Throughout the the undergrad process, probably just like a lot of your listeners, you kind of got to check the boxes and do the things you got to do. You got to take care of business in the classroom, especially with the science classes. Obviously getting involved a lot with, whether it be pre-dental club, volunteer organizations, all that sort of stuff that, and the time, you might just do it because you feel like it's a box to check or a thing to mark off on the application or the resume. But, you start to realize that dental schools they have an important job. They have to decide who are going to fill these spots and become very important members of society. And so when you're going through a lot of that, you're realizing that you need to become the person who needs to earn one of those spots. So yeah, I did my thing, spent a summer to dedicate to the DAT, and was very happy with what I got on my DAT score. And as undergrad progressed, I was involved obviously a lot with pre-dental clubs and a lot of just whether it be volunteer opportunities or leadership opportunities. And this is going way back. I haven't thought about a lot of this stuff in like quite a while, so I'm actually super glad to go back down this road. But then ultimately good, yeah. And then obviously the interview track, ended up getting into a couple of dental schools, and was very happy to be able to stay home in Minnesota, and that's where ultimately I began my dental school journey at the U of M.
Very nice. So when you were choosing between the schools, you're very blessed to get into multiple schools, but what set the school you went to apart from like the competitive schools that you got into? Like what made you choose your school?
Yeah, I think it's a couple of factors. Obviously closest, was proximity to home. I had a couple of opportunities that would have been out of state versus being kind of like, an hour and a half from home, and from being close to, some family and friends. And funny, my next part of my journey is going to completely contradict that, but that was a big factor in it. And obviously, you guys know, you're in the thick of it. That tuition, man, it's really getting out of control, at all dental schools. And so obviously able to take advantage, for me, it was being able to take advantage of some in-state tuition was a big factor for me. So those are probably the two big factors at the time. I would say, looking at it again, maybe now knowing what I know now, and not saying this would have modified things, but I do think maybe some schools that don't have necessarily specialty programs, I think do perhaps provide some opportunities that maybe, some other schools don't, just because when you're out of school, a lot of specialty programs, a lot of your cases will go up there, and maybe that's, you guys, obviously won't necessarily talk about that. We can probably edit this part out. But that's a big factor, is I think schools that don't have specialty programs, maybe the students maybe get a little more opportunity to maybe do some tougher things. So that'd probably be one big factor that going in, you're probably not really aware of, but would definitely be a factor to consider.
That's great. Yeah, I don't think anybody has ever addressed that issue before. So that's a great point. So when the students are looking at the different schools, perhaps it might be in their best interest to choose one that does not have a specialty program, so that you can eventually do those procedures or have the opportunity to do it. So
yeah, there's two sides to that coin, totally. On the other side of it, you have the opportunity, like, I don't know, I remember in dental school, like if I had a patient that didn't show, like I would literally pop into endo and literally sit and watch them do one, or I'd pop into oral surgery and, watch them do a thirds case, or go to the pros department and watch them, like, prepping. So there's definitely two sides to it. Like if you take advantage of it, there's a lot you can learn, but there are a lot of instances where it would just be a tough case and it would just kind of automatically get booted up to the specialty clinic. So there are two sides to the coin, but that's probably the biggest point that I would make, is the opportunity for some of the tougher stuff.
That's great. I love that. So looking back on your first year of dental school, what was that like?
Yeah, I remember kind of coming in, and I don't know, you guys probably remember too. It's just, you kind of get in, you're with a whole new group of people, and I don't know, maybe at the beginning, everyone's kind of sizing each other up and, maybe looking to each other as maybe a little bit of competitors. But as time goes on, everyone gets to know each other, and you do become kind of like a family. I remember the first year of dental school. I do remember, I'm open to talk about some challenges. I ended up doing pretty well, when I graduated, but, I got smacked in the face with a C, in a waxing class that kicked my butt first semester. And yeah, I don't know, that took its toll on me, man. I wasn't used to struggling with stuff. I was pretty much straight A's through undergrad, but I do remember that. And that really, like I said, it was a challenge that I needed to overcome. And, sometimes, you don't realize it when you're in the middle of it, but a challenge that's put forth for you, it makes you just have to put in more work and, step it up. So as petty as that sounds now, I do remember really struggling waxing up teeth, and now it's really no part of my daily practice, but I do remember that. And then as second year kind of transitioned into that, it's more and more the sim clinic and more of prepping teeth and going to the tooth lady and getting tons of those to practice crown preps and all that. And I think that's kind of when I started getting involved a little bit with more organized stuff with with ASDA and going on some trips and things like that. I really enjoyed that. I had the opportunity to go to a couple of, national leadership conferences and the annual session. And it was great to be around kind of just other movers and shakers, in dentistry. So I do remember that kind of starting in my second year.
Right. I mean, you're right. There's definitely some movers and shakers. There's also people who are just kind of laid back, and they're like, okay, I'm just going to do dentistry, and that's going to be it. I'm going to work for somebody one day, and that might be the extent of their career. That's fine. That's totally fine. But I know a lot of our listeners are some of the more motivated individuals, so they're probably more interested in taking the path that you've taken. So going back to when you were struggling with the class, what is something that you kind of told yourself? What was your mindset? And then what is an action that you took so that you could overcome that? Did you, throw more time at it? You study more, practice more? What did you do? Did you get a tutor?
Yeah, I think that just showed me that my biggest thing was I realized that I wasn't putting in the time that I needed to. So it was going in there. It was, and I had somebody help me out and tutor me and take a look at some of my stuff and point out some tips and tricks. And yeah, for me, it was just reps. It was getting in there, putting in the time on the weekends, when that's the last place you want to be, is at dental school working on stuff. But, that's what I realized that I was lacking, was this. I just probably wasn't earning the result that that I was putting in the effort for. You know, it said, Justin Short from TLP, a lifestyle practice, says, you know, you can't expect results that you're not willing to put in the work for. And I think that was the biggest case for me at that time. And, you know, I just realized that I needed to, like I said, put in more time, put in more reps. And, you know, ultimately, like I said, got my lone C of dental school. But, you know, it was humbling, but, you know, we got past it, we moved on. And like I said, it's water under the bridge now. But like I said, going down memory lane, a lot of the stuff that I haven't thought about in a long time, that one brought me back.
Yeah. So now that you're looking back, what would you tell yourself as a D1? So you've got 4 years ahead of you. What would you tell yourself to do to change for the rest of dental school?
That's a good question. I think ultimately where how things played out for me as far as grades, as far as involvement that I was involved in, you know, clinical experience, I honestly don't know if I would have changed a whole lot. I was pretty happy with how a lot of things fared. I think a lot of people, it's probably very good and would be a very beneficial exercise to really plan out what somebody wants the future to look like. And I know that's very difficult to someone who's just applying to dental school. Like, I have no idea what things are going to look like, you know, 5 years after I graduate. But what I mean by that is kind of having an idea of what you want to do. And that's really going to help you set, you know, your steps in the right direction. And what I mean by that is for somebody who, you know, wants to be an associate of a group practice, their journey through dental school is going to be very different than someone who wants to, say, be an oral surgeon. You know what I mean? It's a lot of these things that if you know where you're going, it'll put you in the right direction. Or somebody who, even when you get out, you say, okay, well, I want to be a part of a group practice, or I want to have a partner, or those things are all very different than saying, like, okay, I knew that a couple years out, like, I wanted to put myself in the opportunity to buy a practice and to be a sole practitioner. So I think every young, you know, dentist, even potential applicant, and especially young dental students, should start to think about, you know, where it is that they're going, because that's really going to help them make the right decisions and take the right steps along the way, and just really decide, what do we want the end game to look like, and what are those right steps. For someone whose ownership might be sooner, it's, you know, being at the top of the class probably isn't maybe as important as starting to dive into what it takes to buy a practice or to run a practice, versus, like I said, somebody who maybe early on is dabbling with the idea of a specialty. You know, the grades and involvement better be where they need to be to give themselves that opportunity.
Right. That's funny, because you've heard like what George Hariri has said, where he focuses on getting the 75s or whatever. That's crazy, man. I can't imagine that.
That's my saying, 75-year dentist.
I heard that, and I was actually kind of, you know, blown away by that, to be honest.
Yeah. So, okay. So as you move towards clinic, what were some of the challenges that you that came upon you when you started getting more involved in the clinical? And give me some challenges clinically, and then also challenges with communication with your patients.
Well, and you guys are probably, you know, being in your third year, kind of in the midst of this, kind of the first time you do anything, you're kind of nervous and you're shaking. And I remember that. I can remember the first injection I gave. I can remember the first tooth I took out. I remember the first filling I did. You know, anytime you do something for the first time, you know, you're going to be nervous. So I want everyone to know that if they're feeling that, that's normal. You know, that's normal to be nervous for that first endo that you do, and you're like, oh God, I did this on a typing out, now am I gonna be able to do this on a human being? Or you know, I read about this in the textbook and now it's time to do it. First challenges, I mean, I remember the first crown that I did, and it's just everything from access to being able to try and work in the mirror, and you know, and I ended up with probably this not so pretty prep that took us, you know, like 4 hours to do it, and not a great impression. And it's, you know, everything's a stepping stone. So I want everyone to know that, you know, the first time you're doing something, the next time you're going to get better at it. And the time after that, and then the 10th time you do it, and then the 100th time you do it, every time you're going to make progress, and it's going to greatly improve. But yeah, I would just say a challenge was any of the first things that I did. And, you know, like I said, you're nervous doing it, but every time you do it, I feel like your confidence level goes up. In terms of communication, I mean, honestly, this is something that I'm really diving into right now, because dental school, you won't really learn a ton of, what is the best way to present things or to talk about things. And, I think by default, we're very technical in nature, and it's going over and it's describing surfaces and procedures and billing codes and a lot of that stuff. And a lot of times the student or the patient is just kind of wondering, well, what does this even mean? Whereas kind of what I've really started to incorporate of late is really kind of try and get to emotion and find out what's important to them. And this is something I think would be great to start in dental school. It's really when you sit down with a patient and say, what's most important to you when it comes to your oral health, versus just going right in and saying, yep, you need this, you need that, you need that. And their answer to that is going to really help you dictate towards them, because somebody who says, I don't have any back teeth and I just need help chewing, versus somebody who comes in and says, I hate how my front teeth look, they have completely different needs. And so I would really start to challenge you, even in dental school, start asking your patients that question. What's most important to you when it comes to your oral health, and how can I help you with that? And then just be quiet and listen to what they have to say. And like I said, this has been something I've been working over the past few months, and it's really revolutionary of the responses you get. And then what you can do is basically, what treatment that they potentially may need, but it's you use those triggers to basically fit the two together. If someone says, it's important for them to keep their teeth and they don't want to lose any more teeth, well, then it's saying, okay, that's perfect. I can totally help you keep your teeth. This is what we need to do to keep your teeth, versus just going right to and saying, you need 19 DO, you need 30 crown, yada, yada, yada.
Right. That's great. Yeah, that's excellent. One of the things that I never would have expected to run into is it almost seems like our treatment planning gets kind of pushed around by what we're allowed to do and what we're not allowed to do in dental school. So exactly what you're saying, like, okay, the patient comes in, I want implants. Well, we can't do implants. I can offer you an RPD, which just, oh God, but
So far second choice.
It's not my first thing that I would prefer to do, but that did you run into something like that where your treatment planning was kind of dictated by
the school?
Yeah.
Well, totally. And you got to send them to the perio department, and you have to get all the scaling and rip planing done, and the perio department's booked out for a month. And believe me, no matter what school you go to, it's kind of the nature of the beast. You kind of just have to do the best that you can with what you're given. I think if you ultimately show your patients that you care about them and you want to help them, and that's one of the benefits that you guys got, is just saying, hey, this is the nature of the beast. This is what we got. Unfortunately, it's going to take a while, and it's going to take a lot of appointments. But in dental school, you're kind of limited by the walls that you're in. What I want you guys to know, and all listeners, is that once you get out, kind of those walls fall away. And sometimes it's like a wide open pasture, and you got to realize that you're in charge then. And that's why I'll talk about my experiences in my AEGD residency. I found were super, super helpful, and I would have done that again in a heartbeat.
Wow. Would you say it kind of bridged the gap between like regular 4 years of dental school and then private practice ownership, or just practicing in general?
So all, GPRs and AEGDs are going to be different, and they're all going to have their different strong points and their weak points. I guess for someone who is maybe wondering if that's a next step for them, the biggest things I would say is you're going to come out of dental school, and, there's going to be, like I said, differences between schools, but you're going to come out, confident, probably doing obviously your composite and your class 2 composites, and you're, probably, single anterior, canal, root canals, and, some extractions and things like that. What I really knew is that I wanted to be really a high level practitioner. And by that, I mean, I knew I wanted to be doing implants, restoring implants, locator dentures, eventually wanting to get to like, fixed hybrids and things like that, which are, big fixed implant dentures. I knew I got things on my list that include, IV sedation and cosmetic stuff. So I really felt that was my next best step to help me level up in a lot of areas. I wasn't saying that I didn't feel confident or competent in, but I knew that I wanted to know what high level care looks like. So that's coming out on the other side of it. I would say that was my biggest takeaway is, having worked one-on-one with an endodontist, every Friday, I know what a good endo looks like and how a good endo is done. And, working with a good prosthodontist and a good periodontist and an oral surgeon, like, when you got somebody there to help you, to coach you, to teach you, to talk about materials and processes of, why are we doing the implant this way, or, why are we using this bone graft material, or why are we using this technique to get these thirds out, that really took me to a whole nother level. And like I said, I'm really glad that I did it.
Awesome. So before we get into the AEGD application process, what is one thing that you would tell D3 or D4 Trent that you need to do before you exit dental school? If you could go back, what is one thing that you should have worked on D3 or D4 year?
I think the biggest thing about D3 and D4 year is you really get out of it, what you put into it. And what do I mean by that? It's, you have something scheduled and patient doesn't show up. And then you can either kind of, at least I don't know how it's there, you could either kind of sneak out the back door and really do nothing, or you could, try to find an opportunity to learn something. Like, if it's, whether it's hanging out in a specialty department, or that was probably my biggest takeaway. So it's kind of funny how I do say there's two sides to that coin of the specialty programs, but anytime I wasn't doing something, I was trying to make sure that I was learning something. And at the time, it may not seem super valuable, but when you get out and you're on your own, you don't necessarily have someone to bail you out or to help you. The more things that you can learn are definitely the better. And, some dental schools have outreach opportunities, or, where you're outside the dental school and you do various things like that. Like those are huge for just getting more reps of whether it's fillings or extractions. So my biggest thing is, I know even towards the end of the fourth year, you start to get tired of the system and all the rules and the red tape that goes with dental school, but it's really trying to maximize your opportunities to do as much as you can. And obviously I know now with COVID, and that presents a whole new list of challenges and things that are really outside of most dental students' control. But I really do think it is very important to try and maximize, your opportunities and try to learn something every day.
Right. Okay. So as we go into AEGD, a lot of our listeners, they're like, hey, should I go into AEGD? Can you break down the application process for AEGD, and then let's talk about your experience?
Yeah, so it's, I don't know, in some ways it's kind of almost like starting over the dental school process again. You got to get good letters of rec lined up, and it's obviously putting like a statement together. So it's very similar to that, and it's kind of almost like like I said, kind of a pseudo dental school application again. It's your grades and where they need to be. That's obviously a factor. It's obviously going to be different for, say, an AEGD or GPR versus, oral surgery or an ortho residency. But I think definitely if that's something's interested, I think grades are at least a partial factor. Next thing is just they do want to see that you're, kind of involved in stuff. It's hard when dental school does bring a lot more demands than undergrad did, but it's, you're involved in any sort of research team, or, whether it's admissions committee or volunteer stuff, or you participating at the volunteer clinic. Those are all sorts of things that I was involved in. I think that did help my application moving forward. But yeah, I'd say the best thing to look when it comes to that is looking at it like a similar to a dental school application. I know some of them now, I don't know the exact status with whether it's the ADAT or the GRE or stuff like that, but some of them may require some form of admissions test. I'd actually like to hear from you guys. Are a lot of programs requiring ADAT currently? Are you aware of that?
I'm not sure, because I know some things are changing, and also all the tests are changing as well. So I don't know. Some people have to take certain tests, other people have to take different tests. My answer is I don't know. But so when you were choosing your program, how do you, so that's like the biggest question everybody has. How do you choose a program? Because how do you know if it's a good one or not,
I'd say that is a very tough question, because if you choose wrongly, it's kind of unfortunately like a fifth year dental school and waste of time. You choose the right one, and it's going to change and shape the trajectory of your career. The biggest thing that I can say is sending out feelers from current residents. That's really what's going to tell you about what's there. You can do, kind of as much research as you can. I know David Rice with Ignite DDS kind of puts together at least a little bit of a residency guide that kind of talks about, gives you at least some of the ins and outs, but your best information is going to be from either current residents or recent ones. So you kind of got to do a little bit of exploring. You got to kind of do a little bit of your research, because every one of them is going to say they're going to have a list of procedures that you do, but how many of them are, it might say, oh, implants, and they're like, oh yeah, like 2 residents each restored like 2 implants, and with really no surgical experience. On the other hand, you might have an AEGD or GPR where somebody might face 50 to 100. So they are all very, very different, and what their patient base is, what their strong suits are. So I would say David Rice's guide from Ignite DDS would probably be a good place to start. But other than that, it's just you kind of just got to do a little digging and speaking with programs, and then getting in contact with current or recent graduates of those programs.
Right. So you would say that some programs tailor towards certain specialties or whatever, more so like they're heavily endo or something like that, depending on the area and demographic.
No, they are, and some of them might just be all extractions. Where you say you might want to get more, say, advanced prosthodontic work, or like I said, restoring and placing implants, and whereas like some maybe more the hospital-based ones, you're going to be more like for instance, I wasn't really looking to go into like oral surgery, and a lot of them are basically almost like a stepping ground to go into OS. You're dealing with big swellings, you're going to the OR, you're doing a lot of stuff. Wasn't really the right fit for me, but that might be a perfect step for someone who's maybe thinking going into oral surgery. Whereas like, another program like mine that was very just general dentistry and, based, like I said, mine was in advanced education in general dentistry. There was a lot of endo, a lot of, implants, a lot of crown and bridge, a lot of just advanced prosthodontic cases. So, and that goes back to what I said earlier, just knowing really what your vision is, what your next steps are. That's really going to help you dictate what's the best program for you.
Very cool. So like, let's say I wanted to go into oral surgery, but I didn't have the grades for it. Do people use like an AEGD or GPR as a stepping stone before they go directly into an oral surgery residency?
Totally. And then there are actually things called internships, where basically people will do, basically a year of very similar to, it's like an AEGD or GPR. And some of these programs will take them. You're just kind of getting, the reps and the experience, and it's kind of something for the resume for helping. So yeah, it's totally, that's very common if people end up, say, applying for like both, they apply to OS and then kind of have, maybe some GPRs as so like a backup plan. But yeah, that's always a good building step. And sometimes programs want to see that, to be honest. A lot of surgery, or a lot of specialty programs will end up having people, whether they worked in private practice or did some sort of AEGD GPR prior to it.
Okay. So what was it like when you went to your interview for the residency program? What's something that applicants should kind of focus on, and then kind of some tips? Because I know a lot of students say like, okay, make sure you really become friends with the residents that are there right now, all that sort of thing. What's your opinion on that?
Yeah, I think I do agree with that totally. I think the other thing you got to look at is a lot of these program directors, they're kind of got like puzzle pieces, and they got to see, like, they got to put a team together that they're going to want to deal with, and that they're going to want to see in a day in, day out, and who's all going to kind of play nicely in the sandbox together. So, I think sometimes like a hard charging gunner type, who doesn't come off the best at, an interview, when they know that, look, they know that the whole group of residents is going to be spending a lot of time together, and they're going to have to help each other and work together and be coachable. So I think it's really, coming prepared, meaning reflecting on experiences and being prepared for, for harder questions of everything from, I don't know, how'd you deal with a difficult case or a difficult patient, and what'd you do about it, to maybe a disagreement with a colleague. So I think that's maybe probably the most overlooked part, is that, like I said, they're basically looking at it, they're assembling a team, and they want to make sure that they obviously want the best and the most qualified, but they also want personalities that are all going to, mesh together as well.
Okay. So as we're phasing out of, I guess, the educational portion of your career, what is one thing that you wish that you did, looking back, as we got about a minute here, looking back, you wish you did during your residency program?
Honestly, man, I don't really, have a ton of regrets with it. I feel very happy with a lot of the clinical experiences I was able to get, the relationships that I built, and it really helped me become the dentist that I am today.
Awesome. Love it. So it was that good of a residency program. Great.
All right, guys, that'll do it for an interview with Dr. Trent Neisen, a new private practice owner in Minnesota. We wish him the best of luck in his future endeavors as a private practice owner. He's been in about 2 months and he's doing great already. We hope you guys enjoyed this interview with him. He provided a lot of good insight and information. We'd love to have him back on, discuss more stuff as a new dentist, just to give us a really good bird's eye view of what we can expect as we approach his position later on in life. So, as always, follow us on Instagram at dental.student.vibes. We hope you guys really enjoyed it. Let us know if there's anyone else that we can have on for you guys. We could try to get them, or we try to get somebody that can talk about a topic you guys want to hear. So, as always, stay safe and vibe on.